So the diagnosis with patient A was Marfan syndrome. It's an autosomal dominant disorder of varying severity. The disease affects the connective tissue and results in abnormal length of the extremities, like the arms, the legs, fingers, toes. Affected individuals may also have problems with their eyes. Marfan syndrome can cause aortic aneurysms and aortic dissection, as well as a mitral regurgitation and aortic regurgitation. And the findings that, like the test and stuff that went with that, the patient complained of syncope, and he had a systolic murmur, which was very evident. The echocardiogram findings were that he had an increased size of his aorta, which is called an aortic aneurysm, which is found in Marfan syndrome. The MRI confirmed that aortic aneurysm, and this, like I said, this is the pedigree showed the dominant pattern of inheritance. With patient B, he was diagnosed with Ellis Van Creveld. I think I said that right. I don't really know. This syndrome represents a rare autosomal recessive trait. The fact that it is found more commonly among the Amish people is explained by the founder effect, which occurs when a gene pool is restricted because the population is relatively isolated and has descended from a few individuals. Ellis Van Creveld syndrome is characterized by atrial septal defects, which in severe cases results in affected individuals having a single combined atrium. Other manifestations of the disease include extra digits and dwarfism. And patient B was a dwarf. He complained of breathlessness and had erratic heartbeats. When auscultating the heart, it was very evident that he had abnormal heart sounds. The wall between the right and the left atria, it was completely missing, which is a severe congenital mitral septal defect. And his pedigree findings showed lineage support autosomal recessive pattern of inheritance. With patient C, if I remember right, they were diagnosed with mitral stenosis, which is the main cause of mitral stenosis in adults is rheumatic heart disease. In these cases, an acute child with rheumatic fever causes the mitral valves to become calcified or to be thickened, which leads to progressively narrower opening into the left ventricle, which is exactly what this gentleman had. It was very evident when auscultating and looking at the echocardiogram that valve was thickened, more specifically the leaflets with that. The patient complained of dyspnea, fatigue, and had fatigue with strenuous activity. The pedigree showed for this guy that the condition was not heritable. So that is good for him and his family.